But as you're all aware, there is a rail strike today, and it made sense for both getting to the meeting but also getting away afterwards to hold it virtually. But we really do have every ambition of making sure that the next partnership meeting is held in person. Because there are so many of us, I make it 39 so far, I'm going to suggest that we don't do introductions and go around the virtual table. It's difficult enough to do when we're physically in the room, but virtually I think becomes really complicated. So can I suggest that when you speak for the first time, as I've just done, you introduce yourselves, and that will help for the recording and for everyone listening in. And I see we have some guests, which I'm absolutely delighted to see. And again, I look forward to meeting in person. So when you speak, if you wish to speak, if you could use the electronic hand, that would be helpful, because there are 42 of us now, and I don't have everyone on the screen, obviously. So if you do wish to speak, can you please use the electronic hand? And that means I'll be able to bring you in. I'm not aware we've had any apologies, Andrew. And can I ask everyone to mute, please, because sometimes we're getting a little bit of interference, unless obviously you're speaking. Andrew, I'm not aware of any apologies. Is that correct?
That's correct, Chair. Thank you.
Excellent. That's really good news. Thank you, everyone. So moving swiftly on to item 2, declarations of interest. As you all know, you are asked to declare any declarations on the register of interest. And if it is an ongoing declaration, you don't need to declare it at the beginning of this meeting. But I do need to ask if there are any specific declarations of interest that aren't on our register of interest that haven't been declared previously. And if so, could you either indicate in the chat or put your hand up? And I don't see anyone indicating. If during the meeting you do suddenly realise that there is something you should have declared, if you could pop it in the chat, then I know that the people who are helping us with this meeting will pick it up. So thank you for that. And then now we'll move on to the minutes of the last meeting, which was actually our first meeting back on the 13th of July. I hope you've all had a chance to look at them. Can we agree those minutes as a correct record? I can see lots of nods. So that is agreed. Excellent. And that brings us quickly on to item 4, which is the review of the updated draft terms of reference. There are quite a few papers for the meeting this evening which are around governance, and while they may be a little bit dry, I know you'll all understand just how very important and necessary they are. We need to ensure that we're setting up structures that work for us, and that we have a joint understanding about how those structures are going to come together and how we're going to work in partnership. All of these terms of reference are open to discussion, and it doesn't mean that we can't review them moving forward, but I'm sure you'll all agree it's important that we have them in place at the beginning so that we have a shared understanding. So the first one we're being asked to look at is the review of the updated draft terms of reference. They have been changed since we discussed an earlier version at the first partnership meeting, and as you'll see in the report, I'm really pleased to say that we're now making specific references to champion inclusion and transparency, ensuring the active role and participation of the voluntary and community sector is heard loud and clear, ensuring the voice of service users and carers is heard loud and clear, and that we're talking genuinely about co-production and not talking at people, and also actively promoting the place-based neighbourhood engagement so that we can benefit from both the insight into our local communities that local groups have, but also bring together the really important work that's being carried out at place at borough level to ensure that we are properly joined up and that our priorities are everyone's priorities. So we will be keeping these terms of reference under review. There will be a formal annual look at them again to see if they need to be changed in any way, but we do need to start off with something. And I'm really pleased to see that a lot of the conversation that we had last time has been fed into these terms of reference. Happy to bring in anyone if there's any points of clarification, any concerns or anything that we think is still missing before we move on to agreeing them. And as always, I will take silence as consent, but give you just a little bit longer just in case. I don't see anyone indicating, which I'm going to assume means that we're all happy with these terms of reference. As I say, we need to start with something, and having these terms of reference provide us with clarity about how the different parts of the system are going to come together, but we will be looking at them on an annual basis. So if things do change, as well they might, both nationally and locally, we'll have an opportunity to look at them again. In which case, I'm going to ask if we can agree the draft terms of reference for the integrated care partnership. If I can have some thumbs up or in the chat, that would be really helpful. Excellent, excellent. I promised colleagues that we would keep to time, and we're charging through the agenda, which is really good news. The next item is the national guidance and local approach to the development of our integrated care strategy, and I'm going to hand over to Andrew and Karen for this item.
Thank you, Chair.
Thanks,
I will start, and Andrew and I will do a bit of a double act. I'm Karen Broughton. I'm Deputy Chief Exec of the Integrated Care System. In your packs, we've given you quite a lot of information today. One of the things that we're going to begin with, obviously, is the strategy. So when integrated care systems became into being on the 1st of July, we knew that one of the requirements would be that the integrated care partnership would have to produce an integrated care strategy. And we have now received the guidance on that. And what we want to just spend some time with you, bringing to life some of the requirements of the strategy, and also, and this is where Andrew will take over, just explaining how we think we should proceed with that over the coming months in partnership with you all. So on slide 2 of the deck, so it's slide 25 in your packs if you're following. So the Department of Health and Social Care have now produced the guidance. It does a number of things, and it's actually very thorough. It does recognise, however, that integrated care systems are in very different stages of development, and therefore not every ICP strategy will look and feel exactly the same, not only for the development place that everybody is in, but also that the needs of systems are very different. The guidance proposes that the strategy is produced by December, and we'll just take you through what we think that could be in South West London, so that we make sure we've got enough time as a partnership to properly consider what we want to do. And it outlines a number of statutory requirements that we have. So really important that it's based on needs assessments, and that those needs assessments are built from joint strategic needs assessments from local boroughs. And we'll keep coming back to this, the importance of the ICP strategy, building on what happens at borough level, not replacing or superseding it. A really important point to make with this, that the strategy itself should be around where coming together at scale makes a real difference for our populations, rather than trying to replace things that are happening at borough level and in organisations at the moment. It says that we must consider most effectively how we meet those needs, particularly where the Section 75 arrangements may be put in place. It says that we have to have regard for the NHS mandate, that we have to involve our colleagues with Health Watch, but also very particular about the people who live and work in the area. And through the guidance, engagement is a very strong part of the guidance itself. It says that we must publish that strategy and distribute copies to all of our partner organisations, and that, and I suppose this is an important point, isn't it, to make sure that the strategy itself continues to be live and meaningful, that as new joint strategic needs assessments are produced at borough level, or if there's anything significant, that actually we should revise the ICS strategy too. And goes into quite a lot of detail about the purpose, but effectively to make sure that through the strategy that we're working together as ICS partners to make sure that we develop evidence-based system-wide priorities. So again, not borough level, this is system-wide priorities where scale makes the best difference for our populations. That those priorities should be aimed at improving the population's health and well-being and reducing health inequalities. That they should address how those needs are going to be met, and particularly where the best place to meet those needs is. We know we have different layers in the ICS now, don't we? It's really important that delivery happens at the right place, and the guidance emphasises that. And then just that point again about it should be acknowledged through the strategy that things at ICS level are where scale makes the biggest difference, and that complement what's happening at borough and local level, not to replace and supersede. The next slide just identifies, I suppose, that in a visual form. There's lots happening in terms of strategies at the moment, both for the Integrated Care Board, so the NHS part of the system, but also the Integrated Care Partnership. But the bottom left diagram, the bottom left part of the diagram, identifies that they are based and anchored in local need and local health and wellbeing strategies. We move on to the next slide. So I'm now on 27 for anyone that's following in packs rather than on the screen. Also pulls out a number of key headlines. So there are 4 areas that we pull out here. The real the real important part that evidence has in setting our strategic priorities together. And the guidance particularly referenced the fact that the strategy should consider both physical and mental health needs, particularly where those system-wide interventions are the most effective, could be the most effective. Also acknowledges that there are sometimes underrepresented groups in our assessments of need, and that's referred to in the document as inclusion health. So really thinking about people who would often maybe be missed off, those vulnerable migrants, rough sleepers, gypsy, traveller community, sex workers, etc. So to make sure that actually we are considering the needs of the whole of our populations. And that as we do that, that should be over the life course. So as members will know, in South West London, we have Start Well, Live Well, Age Well. That works really well in relation to the guidance, because actually what it does is it follows people through their life courses, but also how they transition between services. And that's one of, again, the important things that the guidance pulls out, that actually we should be really thinking about where transition to different parts of our systems and through different age ranges actually sometimes falls down. Talks particularly around shared outcomes and identifies that the Department of Health and Social Care will set out some further detail on shared outcomes by April. But really, this should be about looking at those health needs, really thinking together about priority outcomes and making sure that we make the difference to our local populations. And I suppose just to pull out from the listening events that we had when we were working together to create the integrated care system, we did really talk, and it was one of the very strong messages from people around this table and beyond, that actually the ICP should be really focused on outcomes, that really focused on making a difference to a small number of areas and working on them and moving them forward and then moving on, rather than trying doing too many things. So those shared outcomes are really important. And then, as I've already said, the involving people and organisations throughout the development of the strategy is really important and a really strong piece of the guidance. And we do that really well in South West London, and the fact that co-production continues to be essential. And then the box on the right-hand side just also identifies the publication and review, which I've already touched on, and the fact that actually it needs to be a live document, so regularly reviewing it. The next slide I'm not going to go into in great detail, but the document is wide, and it identifies a range of things that integrated care strategies should consider. So if I pull out just a number of these, so if we look at workforce, what are the things that we need to do together in terms of creating a sustainable workforce for health and social care as we go forward? What in relation to prevention and population health do we need to do together at scale? Where do we work on anchor institutes together, and where do we come together to pool budgets or share budgets or use Section 75s to really make a difference to those people that we serve? So it gives a huge amount of information on the kind of things that it recommends that the integrated care strategy should consider in each parts of the country. That just try and give you a flavour of the kind of things that the document itself covers. Andrew, do you want to just take over in terms of how we think we should develop that now going forward in South West London?
Absolutely. Thanks, Karen. So Andrew Dimitriades, I'm the Programme Director for ICS Development. So if we just move on to the next slide. So we're keen that we translate, in effect, the guidance that we've had, which is very permissive, and I think it's purposely been permissive, I think, in giving the guidance nationally, that we put this into effect so that we take I think a measured approach to how we develop the integrated care strategy that's absolutely, I think, as Karen said, built on the foundations of work we've already done, I think, as a system, but that we go through a staged approach to developing the integrated care strategy. And I think those stages are really key, that whilst we've set out on this slide that there are a number of sort of defining features to each of them, the most important bit that we've embarked upon is understanding need, I think, across South West London as being the sort of first stage of that work. We've convened a needs assessment group, and Iona and I will update members of the partnership to the progress we've made on that later on in the meeting, but we've convened the needs assessment group to start to look at the material that already exists across the partnership, to map that needs analysis, and then begin to try and make sense of that with a South West London perspective. From that analysis, we will then need to move into a discussion about what might be the priorities that we wish to set out for our population, and to have a conversation about those priorities. And in so doing, we see that not necessarily just as a technical needs assessment from all the data that's available to us, but that we need to build up a picture of what might be the needs, wants and ambitions, I think, for our population. So Charlotte will go on to talk about when we have our seminar session later in some detail. It's key that we begin to collect, and throughout the process, I think, of the strategy development, that we collate all the insights that might be available to us, so that completes and gives us a more holistic picture, I think, about needs for the South West London population. And as a feature of that sort of phase 2 of work that we need to do, which we see taking place later in November, we will have to prioritise what we think are the kind of emerging and key priorities for the population and for the partnership, where it wants to focus its action. And just linking to what Karen said earlier, just in terms of the guidance, the view is that we should, all systems rather, should develop an initial strategy, an integrated strategy by Christmas. We feel it's important that we take a measured approach to it that happens over time, and therefore our intent, and we'd seek the partnership support for this, is that rather than develop a final strategy by Christmas, what we develop in effect is a discussion document that we can have further engagement and input from partners and indeed from the public before we move forward into an implementation phase. So I think that's the work that will take us to Christmas, complete the needs analysis, have, I think, a comprehensive process of engagement as far as possible within the time that we've got, and then we will publish something with some questions, I think, for further engagement. And then in the period, I think, that takes us through January to the end of March, we'll continue with that ongoing discussion about priorities and some of the wider things that Karen alluded to in terms of the scope of the integrated care strategy. We'll take the feedback and input and refine our priorities, and then we would work towards agreeing those priorities in a final strategy that we'd publish in April, but that we'd also begin to think about what might be the actionable delivery plans that go with our priorities. It's one of the things we've heard loud and clear from the discussions of the needs assessment group that we've convened, is a strong desire to absolutely build on the work that we've done and our understanding as a system, but that we need to convert it into actionable change that improves health for our population. So that's the sort of staged approach that we want to take to developing the strategy. I was on a national call yesterday with the Department of Health and Social Care, the Confederation, with the Local Government Association and providers, and one of the things that came out of that discussion that we were having is that it was important that integrated care partnerships were allowed to have the space and time to develop their approach, and to make sure that it's done in a way that builds on our local circumstances. And I think that's very, very important, that we don't rush this. We do it in a proper and considered way within the time that we have. But as Karen says, there is an expectation in the guidance that we will publish something, and we think we will be able to publish something, I hope, by Christmas for further discussion. So if we move on to the next slide, I think this just builds on the earlier slide, in that it tries to say that whilst at one level we're having a look at all the existing plans that we have in our system, the JSNAs, local health and care plans, health and wellbeing strategies. We need to build up a picture with the insights that are available to us from not just the partnership, but from patients, residents. And again, I think that's something that we need to build into our discussions when we come to the prioritisation, but that we should also look to ask as we go to help inform the development of the priorities, but also our final strategy. And I'll say a word or two about that in a moment. We've got to pull all of that together into something that we can make sense of, that becomes in effect our ambitions for the partnership, the priorities that we want to move forward, and then how we convert that into delivery plans going forward. So if we move on to the next slide. So we've got to create a strategy, we've got to do it together. This isn't about the NHS developing another strategy. This is about health and care and our partners developing, I think, a strategy that makes sense, that pulls together the elements, I think, of the wider strategy where we need to join up care and to look at the mechanisms to do that. So priorities will absolutely be at the centre of it, but we'll also need to think about the wider elements of how we move forward integration more generally, I think, as a system. So we're proposing that we would establish a strategy delivery working group that would be drawn from across the partnership. And you'll see on this slide that there are a number of proposed members. It's certainly not exhaustive, I think, in terms of its membership, but there will be others potentially that we want to draw into the work of that group, depending on the nature of the work that we've got to do. And we need to get on and form this so that it can shape and own, I think, the development of the strategy as we move ahead. If we move on to the next slide. And as I've alluded to already, we also think it's important that we gather not just the evidence that we've been looking at to date in terms of the needs assessment, but the opinions and insights across the partnership. And I think there's a series of questions that we'll want to think about, and we'll explore some of this in more detail when we have the seminar later for the partnership. But the kind of things that we are thinking about asking are about asking our partners and members to think about what might be the key priorities for the partnership, again, where system-wide action could be effective in addressing those challenges and opportunities for South West London. It's about understanding what ambition we have, I think, for our local population. And I think the thing that we will, as all systems, I suspect, will find as they move forward to develop the strategy, which will be a challenge, is just thinking about the criteria that will help us decide on future priorities. And one of the debates that we've been having in the needs assessment group is that relationship, I think, between system level action and collaboration and place-based action. The intent of the strategy, and I think there's very much, I think, a strap line in the guide, the building blocks of the work that we need to focus on, but it's where we need to act together, I think, and therefore that might help us think about how we choose things. We need to have a workshop, I think, to give some considered time and space to think about how we determine those priorities, and actually to go through a process of doing that. And the proposal is that we would have a further workshop later in November, once we've begun to synthesize, pull all that material together, and that will hopefully then enable us to develop and prepare a discussion document, which we can engage further on after Christmas. So I think that's all probably Karen and I wanted to stay on the yes, just a few points, and I probably covered off, I think, most of.
I think, Andrew, we can leave those with, they're just our reflections on the final part, aren't there? I think there's two things, Chair, that we just wanted therefore to recommend to the board today. The first is to just review the summary guidance, and hopefully everyone's had a chance to see that and at least get a flavour of it through the conversation today, and also agree the proposed approach to how we take that forward in South West London. Thank you.
Thank you both. And we all understand it is extremely complex. It is a system with a lot of people working with the same group of people to try and ensure that we do something about those health inequalities that have been present amongst us for such a very long time, which I think the COVID pandemic has absolutely brought into stark relief. We have a system that's working at lots of different levels. I'm struck by the huge amount of experience and insight we have in the people on this partnership board and the groups that they represent. Between us, we represent a very large number of people who are working very hard to bring about what we're trying to achieve through this strategy, and as you both said, actionable measures that will actually make a difference so that in a year's time we can look back and say, so what? There was a particular part of the guidance that I thought was actually helpful. Sorry, there's surprise in my voice, but now and again it happens. It says that the guidance sets out that the integrated care strategy will be informed by local joint strategic needs assessments and local integrated care strategies. They're encouraged to focus on activity that can be delivered at cross-system level, while our joint local health and wellbeing strategies being developed by the health and wellbeing boards can focus on what's delivered at place in boroughs and in communities. And I think that helps me understand that what we're talking about is adding value. We're working across a wider footprint, bringing in more resources can actually provide value to the work that we're doing at the borough level and vice versa. And it's going to be a very important part of the role of this partnership board to ensure that there is this two-way communication, that the conversations and the priorities that we're setting at the partnership board do feed in to both the ICB, but also the work that we're doing at place in our boroughs and in our communities and vice versa. And I think all of us have a very specific role in ensuring that happens. So thank you for that presentation. It is still early days, we're at the beginning of the journey, but very happy to take on board any comments that anyone wants to make, particularly looking at those reflection points that have been highlighted. And Michael, do you want to come in first and introduce yourself?
Thank you, Chair. My name's Mike Bell. I'm the Chair of Croydon Health Services. I mean, first of all, what I think I'd want to welcome is the primacy of place in all of this, and Ruth, you just touched upon that. So I think that's really, really encouraging. I think the plans that you've outlined, Karen and Andrew, around engagement are also really encouraging. I've got 4 brief points, if I may, which I'd like to raise. The first of them is that our previous strategic plan iterations had to go through a rather lengthy regional assurance process, which Karen kindly steered us through. I wanted to get a sense of whether there was any of that this time, or now that we're a statutory organisation, presumably the partnership can pass these over to the board for approval as opposed to going through NHS region. The second was to get a bit of a sense from the ICB executives as to the scale of ambition around Section 75. Clearly within Croydon, we have had some fairly ambitious plans around that, but there has been a little bit of caution about how far we could and should proceed with Section 75 plans to deliver integrated health and care for our population. The third area relates to how far we would expect the strategy to cover areas which are where there is accountability for an individual organisation, but the delivery of that accountability actually requires partnership work. The example I'll use would be some of the recommendations around Ockenden, for example, around preconception advice, which, fantastic idea, it will have a really big impact upon outcomes for mums, particularly those from core 20 populations, but the delivery of that probably doesn't rest with the acute sector, although the responsibility for ensuring its delivery does. It rests more widely, and I want to get a sense of how far we should be incorporating some of those, and I'm sure every other sector will have those responsibilities upon them, but they need partnership work to deliver. The final sort of question area was how we're playing in the specialised commissioning side of things, which is being planned across a South London footprint, and how we're planning the cancer work, which is across a South West London, North West London footprint. So clearly that adds a degree of complexity, and both of those are very, very much now about whole pathways as opposed to the final intervention. Just one observation, which is the strategy delivery group doesn't appear to have any trust representation on it at present, and that might be something we want to consider, particularly in response to making sure that the strategy doesn't actually block us from delivering our statutory, our continuing statutory responsibilities as individual institutions, and that may well be the case for other partners, but I'm aware of that within a trust context. So they're my points, Ruth, but really welcome the paper and welcome the process that's been kicked off.
Thanks, Mike. And it's interesting, there is a common thread in a lot of the questions and the points you've just raised about how we're going to ensure that the very good work that's happening locally won't be in any way, if I say hindered, I say it in a positive way, but won't be prevented from going ahead, and that we will be able to develop specific pieces of work that are specific to some of our boroughs. There's a lot in there, Karen and Andrew, and I'm going to suggest that if you could have maybe just a short answer to each, but certainly going forward, I think there are things we need to develop, because what Mike is focusing on is just how very complex this is. And it isn't just about how we're working locally and across our sub-region, but indeed how we're working on a wider basis across London and nationally. So Karen, do you want to have a stab at some of those, but happy for then this conversation to carry on outside.
Okay. And I'll bring in Sarah as well on some of those things as well. So thankfully there is no regional assurance this time, Mike. So we understand that that we're not going to have to go through that process. I think that's probably because there is an expectation and understanding that systems are in very different stages of development, and therefore not necessarily appropriate to do that at this point. So not expecting that at this point.
Can I say hooray, Karen? Hooray! On behalf of everyone. Hooray!
Sarah, do you want to answer the question about Section 75s?
Yeah, so I think it's not just a question for the NHS, it's a question for local authorities as well. So Section 75s are joint, and if I think where we are all wanting to put our monies in, then I think we should be looking at that. So I don't think it's an either or. I think it's do local authorities want to put their money into Section 75s? And we would definitely be up for that discussion in the NHS. Do you want me to do the specialised one as well?
Yes, okay, that's good.
So I chair the South London Specialised Board. That's one of my joys. We recognise that actually specialised services are much wider than one ICS, and it's not just South London either. We have a specialised board set up for South West London as well, which includes Surrey and Sussex. And so we pull in where we need to the right people for the discussions that we're having, Mike. It is obviously still a piece of work that's still in progress, and we don't take delegation until at least next year, but possibly later than next year, depending on what happens. So, but we are working through that, and I think that we are further ahead than most other areas in our thinking on that. And I'm happy to have a discussion outside on that. And we've got a programme director, and we work very well across South East and South West London on that.
In relation to, thank you, Sarah. In relation to the trust rep on the delivery group, I'm more than happy to have a trust rep. So if anyone has a particular person in mind, but otherwise we can canvass that. More than happy to do that. And then your point around the kind of the work that needs wider collaboration, I think that's really the part within January and March that we would get into. So there are undoubtedly actions that will happen at South West London level. There will be undoubtedly actions that will need to happen at various different places in the systems. And the piece of work that we think would be happening in January to March would be looking at where the best delivery is for those things, and where the best collaboration, and where collaboration is going to make the biggest difference. So again, where it's helpful and where it's the right thing to do, we'll put it into the strategy. If those things are being addressed and absolutely fine at local level, then I don't think they would need to come in. But I mean, it's up to us as a group to determine what is the right level of information, what is the right level of delivery that we want to put into here. And I'll probably just stress that really, because when people talk about the integrated care partnership and the system, I suppose it's us that are steering that. So this board will be absolutely instrumental in making sure that the strategy is pitched right, that it's doing the right things, that it's making and taking the right targeted action, and ultimately that it's making the biggest difference for our population. So if those things are best put into our strategy or best put into place, I think there's probably a conversation as we go forward. But yes, would expect to be identifying that in the kind of January and March time.
And apologies, I forgot to introduce myself, Ruth. I'm Sarah Blow. I'm Chief Exec for South West London ICS.
Thanks, Sarah. And thanks, Mike, for raising those issues. I think you've actually provided us with a series of checkpoints that we can keep referring back to. So that's really helpful. And what I am reassured is that everyone is open to the idea that we don't have all the answers here and now, and that we need to develop this together. So thank you for raising those points, and I'm going to put them in a very safe place. I don't see anyone else indicating, and as I say, this is the beginning of the conversation, and if you look at the other items on the agenda, they do hang together very well. So I'm going to suggest that we move to the recommendations, and we're being asked to approve the proposed local approach to the development of the strategy, including the creation of a strategy delivery working group. Is everyone happy with that? Lots of noddings. Yes, excellent. Thank you. And some thumbs up too. Excellent. So let's move on now to item 6. And I said it all hangs together very well. So I'm going to hand over to Dr. Lidington and back to Andrew again to give us an update on the ICP needs assessment group work.
Yeah, Iona, if I just kick off, and then Iona, I'll bring you in as we go. So we can keep this, I think, brief, in that we'll be exploring this, I think, in some detail, I think, when at the seminar session. But just, I guess, just a few headline points to report to the group. So I think, as we said, we agreed at the first meeting of the partnership that we would convene a cross system task and finish group to have a look at undertaking a review of the needs analysis and needs assessments that have been done across South West London, that we would look at the existing health and wellbeing board strategies, joint strategic needs assessments, and local health and care plans. I think that the timing of it was good in that internally, I think within the ICB, Gloria's team had already started some work to map for the Health Inequalities programme to begin to sort of map the common areas, if you like, that were featured, if you like, across all those elements of work, which we've inputted to the work. We've secured some external help to support the process of doing that review. And the idea is, I think, as I said before, is to try and not validate the work that's been done, but to see whether there are any kind of common threads that come out of all those existing local plans, and to see on top of that whether or not there's any additional data that is available to us, which gives us a kind of a picture across South West London. So we've had, I think, 4, if not 5 meetings of that group. We started in early August, and we've been meeting on a weekly basis to undertake that work. We're trying to get essentially a system-wide view of health need, and to have a look at whether or not there's any additional information that we might need that supports it. So within the terms of reference, I think that we agreed at the first meeting of the partnership, we also said that we'd want to look at any information coming out of the pandemic, but we'd also look at, and I think this is very, very timely as well, given the pressures I think that we're facing with the economy, but what might be the kind of wider economic and social impact of things around the cost of living, for example, but other wider considerations as well, and that we would work towards providing some initial feedback to the partnership, and hence the seminar that we have following this, on what might be the emerging themes. We haven't concluded that work. There's more work to be done, but we will be able to give a flavour of that and explore some of it when we have our session later this evening. Iona, I don't know whether you want to give a perspective, I think, on it, just as both a process or how you found it, but the floor is yours.
I think, as always, it's challenging when you're bringing, a bigger population together. I think whenever you get several DPH around a table, again, it's a bit like getting any clinicians as well around a table that getting a united view on what good will look like. So certainly the first few meetings were that sort of getting some consensus about what it should include, what would be best done across a bigger footprint, such as the ICS versus the place. So reflecting that comment earlier on about, that's still to be worked through in the strategy, but having the priorities agreed based on need, absolutely important for galvanizing that action so that we do the doing. So assessing the need, but also then important how it feeds into the strategy for the actions we're actually going to take and make the biggest difference, because that's what this work's all about. So, I think using both social data, the wider determinants of health, so housing, education, air quality, those elements, as well as disease prevalence, utilisation rates, things like that. So we've tried to be both broad in terms of looking at those social determinants of health, which we know are so vital, as well as then looking at healthcare utilisation, disease diagnosis, and getting the blend of the two. Thanks, Andrew.
So that was just a brief update, Chair, but we'll explore it in some detail at the workshop that follows.
That's helpful, Andrew, and you're right to raise the fact that while we're talking about some of the big strategic issues, we also need to focus on the here and now. And I'm sure all our 6 boroughs are gearing up now for a winter that we all expect to be very difficult, and people are going to be struggling. The idea that we're setting up warm centres in our libraries and community centres across our 6 boroughs in order to ensure that people have a warm and safe place to come, I find quite extraordinary in this day and age. I'm worrying about food banks, which now no longer have enough food to be able to feed the people who need it. So absolutely agree with you that we need to look at some of the big issues, but also recognise just how difficult life is for people at the moment and how we're going to ensure that we're able to provide that support to get them through the next few weeks and months, which are going to be very, very challenging indeed. This is just a quick update. I don't know if anyone wants to come in quickly at this stage. But this is very much for information, and we're going to have lots of opportunities, including the seminar and other meetings, to look at this in more detail. I don't see anyone indicating, so in the interest of time, I'm going to power on. And we're being asked to consider the final response to engagement on the guidance once that's published, and any responses from the local health and wellbeing boards. So I think that's fine, and thank you for the work that you've all put into this. I've seen a comment about the previous papers, the previous report as well. Some really good work here, some really helpful work that we can all take back to our places and our various organisations. So thank you for that. Let's move on to item 7. There's been supplementary guidance for health and wellbeing boards, health oversight and scrutiny committees, and the adult social care sector. And I think we need to look at these just quickly one by one. So Andrew, back to you again with Karen.
All right, thank you, Chair. Yeah, so three bits of important sort of supplementary guidance that I think emphasise the importance of having effective partnerships and the integrated partnership having the right relationships, I think, and work together, I think, with health and wellbeing boards, with Scrutiny, and also with the adult social care sector. On the health and wellbeing boards, I think what the guidance is aimed at sort of really trying to sort of refresh and updating, I think, the guidance on the role and function of health and wellbeing boards, which is, I think, a few years old now, and to sort of time that so that it fits and aligns, I think, with the establishment of integrated care systems. It sets out, I think, a number of kind of features really around sort of what effective partnerships might look like, but emphasises the role and relationship of systems with place as well. Obviously as being the kind of holding place, if you like, through which health and wellbeing board strategies are kind of enacted. It goes without saying, emphasises the importance of collaboration as we go forward together, and just raises, I think, a question about whether or not there's any further ways we can strengthen that relationship, I think, between the ICP as we move forward. And I think that's the general thrust of the guidance, Chair, on health and wellbeing boards. And I guess it's a question for the partnership on what else we may need to do.
Thanks, Andrew, and I'm really pleased to see that all 6 Health and Wellbeing Board chairs are present at this meeting. So I think it's really important that we think through this. Piers, I saw you come in first. Do you want to introduce yourself?
Hello, yes, I'm Piers Allen. I'm Chair of the Health and Wellbeing Board in Richmond and also the convener of the Place-Based Committee. I just wanted to check whether the ICP or ICB made any contributions to the guidance consultation on health and wellbeing boards, because it's a draft guidance at the moment. I think the plan was to have a final version with maybe some stronger information on the statutory elements in by the end of the autumn. Just to know whether the ICP made any formal comments on that.
Who'd like to come in and respond to that?
So I'm not aware that we've made any formal representation, but I think we could do if there's still time. Piers, I didn't know that it was a full consultation. So if there is a chance and people would like us to, we'd need to gather views and do that as an ICP.
Okay, thanks, Sarah.
Let's have a look at the timeline, Sarah, and see how feasible that is. But thank you for flagging that, Piers. It's helpful. And Sukhvinder, you want to come in?
Thank you, Councillor Ruth. Yes, I was very interested. Let me introduce myself. I'm Sukhvinder. I'm Chair in Common at Kingston Hospital and also at Hounslow and Richmond Community Health Trust. I really liked the principles that have been flagged up here. I suppose my question is about enablers. I wondered whether there are also enablers that need to be identified that will help facilitate partnership working. I know the guidance talks about data sharing, and I wondered whether there were other aspects of either information or IT that would help accelerate the rate at which the partnerships could work.
That's really helpful. Before I ask you to come back, Mike, I'm going to take a question from you as well, and we'll do them both together, I think. You wanted to come in?
Thanks. Yeah, thank you, Chair. Mine's very quick. It's really, I think that we need to reflect upon and consider the desirability of whether health and wellbeing boards and place committees could meet in common. It's happening in other parts of London, Redbridge, for example, where the place committee and the health and wellbeing board meet in common. It's effectively the same meeting. Whether that would be an effective way of discharging. I don't have a view on this, but I think that it would be useful for the ICP to reflect upon the desirability or otherwise of that. It was something that we did reflect upon in Croydon. It's not something we're seeking to pursue now, but we were very clearly steered away from it by your former co-chair of this partnership. So I think it would be useful for us as a partnership to reflect upon that and decide upon that at some future point.
I mean, my view, Mike, on this off the cuff is that I don't think we should be telling boroughs what to do. If it works for some places, that's fine. If it doesn't work for other places, then that's fine too. I do agree it would be useful to get some feedback from Redbridge to see how it's working. But I personally don't think it's the role of the partnership. The role of partnership is to share that information. But I think each of our boroughs then will need to take a decision on that. But it's certainly something to bear in mind going forward. So Sukhvinder's point about the IT, who can come back on that? Karen, Andrew, Sarah?
Shall I come in on that? I think so.
Yep.
One of the things that the chair mentioned, these are all inextricably linked, these documents. So one of the things that the strategy does ask us to think about is whether there is better kind of data and information sharing that the partnership wants and needs. So it'd be one of the things that we can pick up there. I think in relation to digitals across health and social care provider organisations, we already share information and have been doing so for some time. So I think it depends on the level, but I think if we can pull that out in the conversations that we have on the strategy and the way that we want to operate as a partnership, then actually that's a way of doing that, Sukhvinder.
It looks like you want to come back on that, Sukhvinder, which is fine.
No, that's really helpful. I think if there are mechanisms for taking that forward, let's follow up on those. But I think it will be critical for the patients, the local people, and also for the providers as well.
Indeed, thank you. So let's move on to the next one, which is about the relationship with the health oversight and scrutiny committees.
Do this one. So this again, guidance came out in July 2022. It identifies the ongoing role that obviously health overview and scrutinies have in that vital role of making sure that health services are scrutinised for the local area. It also sets 5 principles, so outcome-based, outcome-focused, balanced, inclusive, collaborative and evidence-informed health overview and scrutiny committees. And South West London, as we know, already has well-established place and ICB relationships with those committees, and there is regular scrutiny on a range of health-related issues. But it is important that we consider the new guidance to make sure that scrutiny and oversight are a core part of how both the ICB and the ICP operate. So I suppose the question we were going to ask, given that we have a strong foundation, but also given that we have new guidance, is whether members of the partnership feel that there are additional mechanisms or additional priorities or different things that we need to do to strengthen health overview and scrutiny in South West London.
Thanks, Karen. And one suggestion I wanted to make, as someone that was involved in the health scrutiny committees when they were first set up, I think we tend to be far too reactive. So we wait for the oversight and scrutiny committees to come to us, to challenge us, to scrutinise on the work that's being done. I think it would be useful to have sight of their forward plans, to have sight of their agenda, and understand what's of interest to them, but also ensure that they're looped into the work that we're doing so that they can actually add value. And so rather than waiting for them to come to us, I think it would be good to reach out. We know who the various committees are in our 6 boroughs, and just make sure that we're better integrated so that the work that's being done within those committees, as I say, has a clearer sight on the work that we're doing and what our priorities are. So I'd like to see more of a two-way relationship rather than just being, I was going to say hauled in. That's not fair. It's far more positive than that, but you know what I mean. Does anyone else want to make any comments on the relationship with health and scrutiny? I don't see anyone indicating. Oh yes, Piers, you wanted to come in.
So I just wanted to make sure whether we're talking about borough HOSCs, are we also talking about our South West London joint, our JOSC as well? I mean, bearing in mind, obviously for Richmond, we're also part of what we attend the North West London JOSCs as well. So I guess they might want sight of our principles, but I guess it's only really pertaining to.
So I'm assuming it's both and all, Piers, and it's how all the various parts fit together. Is that right, Karen?
Yes, it is. The guidance is
So
clear that actually...
what I would suggest is that, because what we don't want to do is repeat everything. If we've got South West London work, I think we should take it to the JOSC, because otherwise I think it causes confusion if we go out to 6 individual OSCs and then we come to one JOSC as well. So my suggestion would be that, you know, the South West London work should go through the JOSC, would be my view. But I'm happy to be told otherwise, but I wouldn't think we'd want to do both. I think we should do either or.
I think you're pretty right, Sarah, particularly since some of us don't, some of us have committee systems, and therefore the scrutiny function is part of our service committees. So I think that would make sense. Yeah. Perfect.
Thank you. That seems fine. And let's now talk about the relationship with the adult social care sector. Karen, back to you again.
Andrew's going to do this one. Just to give everybody...
That's fine. I'll just do this briefly, Chair, if that's all right. So again, welcome views really, I think, from the partnership, particularly local authority members, I think, on the guidance, which I think encourages to sort of think about how we can kind of involve and engage the work of the partnership and its role and relationship, particularly around, I think, the development of the integrated care strategy with the adult social care sector, which I think is included in the guidance. Again, it sets out some principles for what might be ways of working, I think, with the adult care sector, and it's thinking about whether or not there are additional mechanisms or approaches that we may want to take to make sure that we can gain, I think, an understanding and input from the social care sector into the work that we do as we move forward.
And again, I think the financial pressures going forward are going to be an important part of that conversation. I know that at place and borough level, these conversations are happening, but we need to think across the patch what that looks like in practice and how we're going to really ensure that we're able to shift the dial sufficiently to put more effort, more finance and resources into prevention and early intervention, which at the end of the day is not only better for people, but it will stop the NHS falling over. Andrew, there's a very scary message that says we've only got 5 minutes left. I just wanted to check that we're not going to get thrown out in 5 minutes, because I think it's going to take a little bit longer than that.
Yeah, no, we're okay. We have got a little bit of run over time, but we'll run into our break, but that's fine. We'll be all right, I think.
Yeah, and we will be coming back to these issues because they're all very much at the heart of what we do, and it's how we're going to work together with the various parts of the system to enable that we do come up, as was said by Andrew at the beginning, with actionable measures that will make a difference to people's lives. So I think there's common agreement on that, and we'll move swiftly on to item 8, which is the investment fund approach. Just to be clear, as the report is clear, we had to move very quickly for this year, 22-23, in order to ensure that the money went out quickly, and that the various voluntary groups that we're encouraging to come forward to bid for this money were able to do so quickly. In following years, it's going to be very different. But Sarah, did you want to talk to this just quickly?
Yeah, I will be brief because I know we haven't got much time. So just to give a bit of overview, we decided that we would like to have some money that the ICP could have oversight of going into this year and next year. Obviously, we're already halfway through this year, and the ICS didn't start formally till the 1st of July. So as Ruth said, we took Chair's action on this year's, and actually the fund has gone out. So the bidding process has gone out for the fund, but we are looking for people to come onto the panel, which I think Karen and Gloria are overseeing. They're 2 panels that Karen and Gloria are overseeing. But just to be clear, we've created an NHS fund that we're calling the Innovations Fund. So we actually took some top slice money at the beginning of the year from the NHS to actually allow us to do innovative things that weren't just focused on the NHS, that we could all bid for, and that were focused on the priorities of the ICP. And because we hadn't agreed the priorities for this year, we've said the priority is health and care sustainability over the winter period, which I think is a priority for all of us. So we've said that as the #1 priority. Going into next year, we want to have a much more managed process that the ICP oversees, where we can set the priorities and we can go forward. And what we've done in the NHS is we've put in some money ourselves at the beginning of the year, but we also have some national monies that comes down for things like health inequalities and prevention, and we're trying to make that part of the fund as well if we can. We're also happy if anyone thinks they could, as a system, put some more money into this fund that we could use sustainably together to really do something innovative, then we would be up for that for next year as well. We haven't yet agreed the budgets for next year, so I can't tell you exactly what the fund is for next year. But we were really keen to do this in South West London. This is new. We've taken it out of our discussions about our funding, which we are very tight in the NHS. I'm not, I know everyone thinks we've got loads of money, we really haven't, but we really think this is an important part of what we do together. So I think somebody, either Ruth or somebody, will be nominated to be on the 2 panels for this year, and then we'll come back to you with the process. You've got a high level process, but the process for next year, so we can agree that together. That's all I was going to say, Ruth, and then I'm assuming everyone's going to have read it.
That's fine, Sarah. And I know I've said to you, and you've agreed with me, that from now onwards, obviously this year we had to move quickly and we had to take it under Chair's action. But going forward, I'd like to give as much time as possible for local community and voluntary groups to come together and think about how they can make joint bids on specific targeted groups of people that could make a real difference. And while you look at the figures overall, we're talking about several million. I know for some of our smaller voluntary and community groups in my borough, and it's true in all 6, it could make a real difference to the work that they're doing and have a real impact on people's lives. So we're going to make sure that going forward there is a better timeline that will allow people to think about how they can best use it.
Can I just say something on that, Ruth? Because I recognise some people will be saying, this is all too fast, we haven't got the right support, all of those things. We wanted to just get the money out. If we don't get the money out soon, it won't get spent at all, and we will put it into our savings pot. And that is not really what we wanted to do with this funding. So I know the timetable is tight. I know that particularly for the voluntary sector that is difficult, but we would just still encourage people to please do bid through the process. We've given some, you know, contact details. Our place executive leads have said they will help. So, you know, we'll do what we can. The process is not going to be ideal this time round, but we'll get better at it as we go forward, and we'll do a lot of learning.
Thanks, Sarah. So I've got 3 people who want to come in: Catherine, Mine and Peter. Catherine?
Thank you, Chair. Catherine Williamson, Director of Richmond CVS. I'm the interim voluntary sector rep. You can probably guess what I'm going to say, and I appreciate you've set the context regarding the timings, but I wouldn't be doing my role if I didn't say something, because it is extremely tight for the voluntary sector to get involved in this fund. I'm not clear from the fact that it says in the papers that the Innovation Fund money was put aside at the beginning of the financial year, why 6 months later we now have barely 2 weeks notice about it. And in fact, because of the way the process is being set up, I've had information about what's happening locally, and again, Kingston and Richmond places have had to react very quickly to this. We've got the information that came through at 5:30 this afternoon, and in order to try and help with that alignment and ensuring there's not duplication, there's a week for applications so they can go to the place committees first. I mean, that is really hard for the voluntary sector. We've already tried to get some views on it in terms of what could be done, and people are commenting on the timeline. I appreciate what you're saying. You're trying to, you know, this is different for this year, etc. But I'm still not clear why it took so long to sort of get the money out. I appreciate you want to do things for the voluntary sector. That's great, but I do feel the voluntary sector is disadvantaged. I'm sorry, I have to highlight that in my role on this committee. So just wanted to say that. Thanks.
That's a fair challenge, Catherine. I mean, do you want to come back? Sarah, Karen, just to talk about what...
I would just say it wasn't actually agreed right at the beginning of the financial year, and obviously we've only been in existence since the 1st of July. So we have had to kind of agree processes and get chairs action and whatever. It's not ideal. I know we're trying to create something to help people. You know, we may not get everybody being able to access it this year, but we will get better for next year.
And we are very clear, Catherine, I can assure you that from going forward, we want to give people as much time as possible, because I think giving opportunities for smaller groups to come together and make joint bids is absolutely the way to go, and that takes time. So it's a fair challenge, and I recognise what you've said. Mine, do you want to come in?
Yeah, thank you, Chair. Just to introduce myself really quick, my name is Mayan from the representing British Red Cross. I'm the Service Delivery Coordinator for London and Crawley. So I just want to just quick note that we are willing to partner with like more possibilities for partnerships in the future to help facilitate the work, and specifically for the ICP volunteering sector lead, and to get involved with the strategy delivery working group as well. That would be an added value as well. And this is just a quick note that we are here, we are supportive, and we are willing to talk and to coordinate if that will help in the future, so we can work together, and we can like exchange information, so we can like be in contact.
That's a really helpful offer. Thank you for that, Maya. Much appreciated.
Thank you.
And Peter?
Thank you, Chair. I'm Peter McCabe. I'm the Chair of Health and Wellbeing in Merton, and the Cabinet Member for Health and Social Care for London Borough of Merton. I wanted to support Catherine's comments. I think it is important that we try and give the voluntary sector an opportunity to become real partners, and that sort of timetable doesn't provide that. I am reassured by what we've heard that next year will enable us to have more time, and for us to have more oversight of this process, because I think that's really important. That's all, Chair.
Thank you. And I know we'd all echo what you've just said, Peter. We absolutely recognise that. It's not ideal, but the idea of not spending the money would have been even worse. So, yeah, challenge received, Catherine. Maybe we could have moved quicker initially, but it's been quite complex to set the whole thing up, and we will absolutely ensure that going forward it's done differently and better. So thank you for that, and thank you for that conversation. We've also, and no one's made any comments about the allocations of funds. Again, I think that's absolutely the the right way to go, thinking about the winter that's about to descend on all of us. So thank you for that. I'm not aware of any public questions that have been received prior to the meeting, unless you tell me differently, Andrew. Obviously, it's something that we'd encourage going forward, but I don't think we've received any, so we can then go on to any other business. And again, I haven't been advised of any other business that needs to be raised. So we've gone over by 5 minutes, which isn't too bad. I'm going to suggest that the break now, instead of taking 15 minutes, we just take 10. And in 10 minutes time, we come back again and we can start the informal seminar that's being organised. Can I thank you all for your time? It's been a really interesting and thoughtful and provocative conversation, which is what I would expect from a partnership like this. And I'll see you in about 10 minutes. Thanks, everyone. Bye.